Welcome back. Because aspirin is so commonly used in our daily life, you also need to know pharmacokinetics of aspirin. This drug can be administered orally. Its absorption is very rapid, and aspirin can distribute widely in the body. It is mainly metabolized in the liver, but the liver has a limitation to metabolize aspirin. When aspirin is used lower than 1 gram in a day, it's linear elimination. It's the first order kinetics. Half-life is a constant. It's about 2 to 3 hours. But when the drug dose is more than 1 gram, it exceeds the body limitation of elimination. So at these conditions, it's the zero-order kinetics, non-linearity elimination. Half-life is not half a constant anymore. It's about 15 to 30 hours. With the dose increase, half-life is prolonged. Aspirin, it is one acidic drug. It is excreted with the urine from kidney. Because it is acidic drug, so its secretion can be influenced by urine pH value. Actually, aspirin has been used for more than 100 years. Its pharmacological effect and adverse effects are much clearer. Because it is so commonly used, so these adverse effects, you should master them very well. It includes gastrointestinal reactions, blood coagulation drawback, Reye's syndrome. Actually, it is hepatotoxicity, hypersensitivity, including aspirin asthma, and salicylate intoxication, and renal injury. Let's study one by one in detail. GI tract reaction. It is the most common reaction caused by aspirin. It has a latency to induce or aggravate ulcer. Actually, this adverse reaction on GI tract is mostly caused by direct stimulation after oral administration. So, aspirin enteric-coated tablets are more popular, and you also can suggest the patients to take aspirin with meals. Try to decrease this local irritation in the mucosa of stomach. And another reason is because of inhibition COX-1 in the mucosa of stomach. Because aspirin is mechanism of action is inhibit the synthesis of prostaglandins in different size. In the mucosa of the stomach, this prostaglandins is PGE2. This substance has a protective significance for the stomach in mucosa. So once it is also inhibited to produce PGE2, the protective function for the mucosa of the stomach, it also is reduced by aspirin. So sometimes it is necessary to suggest the patients to use aspirin with misoprostol. Misoprostol, it is an analog of prostaglandins. Try to prevent peptic ulcer. And because of these adverse effects on the GI tract, it also related to antiplatelet reactions, actually bleeding or hemorrhage of stomach, it is relatively common and dangerous. Try to avoid it. The second adverse effect of aspirin is blood and blood coagulation drawback. Because many patients require aspirin in low dose to prevent thrombosis formation, try to decrease the risk of cardiac vascular events. But antiplatelet effects caused by aspirin in low dose. It, one hand, inhibits the thrombosis formation. At the other hand, it also inhibits hemostasis when it is necessary. So it can increase bleeding time, decreases platelet adhesiveness, and aggregation. So for the patients, if they need a surgery, suggest them stop 1 week, at least 1 week, prior to surgery to avoid the bleeding complication. Because, this antiplatelet reactions, it is irreversible, and the platelet has no nuclear. This function recover requires a new platelet production. So, because lifespan of a platelet, it is about 7 to 14 days. So stop at least 1 week prior to surgery to avoid bleeding complication. And some individuals, when they use aspirin at large dose, may cause hypoprothrombinemia. For this problem, coagulation, it is relatively difficult. Maybe vitamin K, it is useful for this. The third adverse effect of aspirin is hepatotoxicity. Hepatotoxicity includes 2 forms. One form is dose-dependent. The patients with connective tissue disorders. Another form, it is hepatic injury. It is caused by Reye's syndrome and usually occurs in children. This Reye's syndrome, although it is rare, but it is fatal. It is characterized by fulminant hepatitis and cerebral edema in children. It is usually caused by administration of aspirin after a viral infection, such as chickenpox and influenza. Because these 2 kinds of viral infection, fever is so common symptom. It's very common symptom of this disease. And aspirin, it is used to relieve fever. It's very effective. But because, I mentioned, the liver has a limitation to metabolize aspirin. For the children or teenagers, their body development is not enough. So metabolism of aspirin, it also is not enough. So for the children and teenagers under 20 years old, they should not use aspirin in viral infection, to treat fever. It actually had better not use aspirin to relieve fever in children. Try to avoid these serious adverse effects. Hypersensitivity caused by aspirin occurs approximately 50% of patients. The symptoms like rhinitis, urticaria, and bronchial asthma to laryngeal edema, hypotension, even shock. This is the allergic reactions to aspirin. This bronchial asthma, if it is caused by aspirin, it also caused by aspirin asthma. The mechanism of this hypersensitivity is because aspirin moves arachidonic acid metabolism to leukotrienes and other products in lipoxygenase pathway. Now, remember this? Arachidonic acid has two pathways to metabolize. One is to produce prostaglandins. Another way is leukotriene. But when nonsteroidal anti-inflammatory drugs inhibit COX, this pathway is blocked. So there are more arachidonic acid metabolized to leukotriene to produce leukotriene. So this is a mediator of allergic reactions. So the patients has more incidence of hypersensitivity. Now, remember this terminology. It is caused by aspirin asthma. Some individuals, after using aspirin, they have bronchial asthma because aspirin increases the leukotriene production. So try to know how to state that aspirin asthma. Next adverse effect caused by aspirin is salicylate intoxication. Actually, aspirin, after absorption in the body, they convert into salicylate. So this intoxication caused by salicylate intoxication, it usually occurs in some. It usually caused by overdose. It is a mild salicylate intoxication. Symptoms include nausea, vomiting, headache, dizziness, tinnitus, deafness, sweating, and mental confusion. Actually, it is a salicylism. Oh, maybe tinnitus. This word. It means noise in the ear. The symptoms of more severe intoxication include hyperventilation, fever, restlessness, even ketosis. Once the patients have these symptoms, it often warns you there is a salicylate intoxication. So try to take some measure to rescue the patient's life. First one is withdraw at once. And the next one, more important, is intravenous injection sodium bicarbonate to increase the pH value of the urine and then promote the excretion of aspirin. Remember, I mentioned aspirin, it is one acidic drug. So increase pH value of urine by intravenous injection of sodium bicarbonate. It can promote excretion of aspirin because of air trapping. Remember that? Next adverse effects of aspirin is renal injury. Actually, on normal kidney, it has no obvious effects. But for old people or patients with problem on the heart, liver, or kidney, maybe it can cause edema and diuresis. Because in the kidney, it also have COX. It is COX-1. This aspirin also inhibits that COX and then inhibits the synthesis of prostaglandins E1 and I2 in the kidney. Finally, it can affect renal hemodynamics and water and salt balance. Okay, here there are 6 points of adverse effects of aspirin. Maybe it is not very easy for you to memorize. So there is a tips to help you to remember. Aspirin. So these adverse effects caused by aspirin include aspirin asthma. It is one kind of hypersensitivity. And the salicylate intoxication. It usually caused by overdose of aspirin, exceed 5 grams in a day. And peptic ulcer, it means gastrointestinal reactions. Intestinal gastric bleeding, it caused by antiplatelet effect, antithrombotic action. This is blood coagulation drawback. And Reyes syndrome, it is one hepatotoxicity in children. So don't use aspirin to relieve fever in children. Injury of kidneys and noise. Just now I mentioned this is the meaning, this word, tinnitus. It just occurs at high doses. It is one sign of salicylate intoxication. Okay, that's all for this section. So how about the other nonsteroidal anti-inflammatory drugs? Yeah, aspirin, it is the representative drug in these families, but there are more agents to substitute its antipyretic and anti-inflammatory effect. But only antiplatelet effect cannot be replaced by the other agents. But I should mention this. Other non-steroidal anti-inflammatory drugs cannot used to prevent to decrease the risk of cardiovascular events, but they can, when they used together with aspirin, they can also increase the blood bleeding time. Yeah, when they used alone, it also can increase blood bleeding time. You should understand this. Okay, go to study next section.